You just heard from Connie about the Belk Fit for the Cure and the efforts to benefit the Susan G. Komen Foundation. The truth is, it's a frightening time for a woman to hear a breast cancer diagnosis, and so important to think about getting a second opinion, and that's where our next guest comes in. So thrilled to have Angela Reich here. She's a nurse practitioner at the MaryEllen Locher Breast Center here in Chattanooga. Yes. Good to see you.
Thank you so much for having me.
You and I were talking a little bit before the show even began about how lucky we are to have the breast center here in Chattanooga, and yet many people don't realize really how world-class it is.
Right.
You bring a team approach to the care you give that's second to none.
Absolutely. We have a multidisciplinary team that consists of pathologists, radiologists, genetic specialists, the surgical oncologist, and medical oncologist. There's a whole team. We meet each week to discuss new cases, new diagnosis.
And you tell me that often when you're explaining this to women who are coming in and they say, you mean I'm going to be discussed? But you are, and by the very doctors and team who are going to be caring for you.
Absolutely. We want each woman to feel special and that they are receiving the best care possible.
Okay, and that's what drives all of you every day, is to give them that best care. And so you know that you want them to be in the place where they're the most comfortable, but you do offer this second opinion clinic there at the MaryEllen Locher Center, and then they can choose to stay with you or go back to their own doctor. It's just for peace of mind.
Absolutely. We want women to feel confident in the care that they're receiving, and so if a woman comes in and she has had an abnormal mammogram, maybe she needs a biopsy, or maybe she's being told that she doesn't need a biopsy. That would be reason to seek a second opinion if she is not confident in that, in what she's being told. Also, women that have received a new diagnosis of cancer, if they want to explore other treatment options, then we are happy to see them.
You know this too better than anyone, that when that diagnosis comes through, it doesn't affect just the patient, but her whole family as well. So when they come for that second opinion, do you welcome family members coming with them to ask questions?
Absolutely. We actually tell people, bring a second set of ears, bring your family with you so that they can take notes, ask questions. We want them to feel confident and reassured. So,
when they come in, I want to go back to this team approach a little bit, and if you can elaborate a little bit on who part of that team is, because it goes so far as to have a dietitian, right? Isn't there a dietary side to it?
There is. So we have a support services through the MaryEllen Locher Breast Center that include dietitians, social workers, even a medical tattoo artist. So there's a whole
So essentially you're doing the thinking for them, because by having this team in place, when they come in and they have a diagnosis, each person sort of knows, okay, I'm going to step in to assist here and at this time.
Yes.
The family doesn't have to go knocking on doors. You're knocking on theirs.
Right, absolutely.
So with the second opinion, if anyone's watching today and they have maybe had a diagnosis, first of all, how recent does your diagnosis need to be able to come and take advantage?
Anytime. If you are wanting a second opinion, we are happy to see the patient. All they have to do is call. One thing we want to stress is that you don't need a physician referral. A lot of people are reluctant to get a second opinion because maybe they don't want to offend their current physician that they're with. And we want women to feel empowered and to feel confident about their care, to give them peace of mind. So absolutely, just call us. No referral is needed.
And when they come to you, because they also don't then want to talk about their doctor and appear to be ungrateful, but is it helpful for your team to even hear perhaps the advice they've been given, to know how to either support that or perhaps offer a different opinion?
Absolutely. We sometimes do support that, and then other times give them options that maybe they weren't given before. So
it's as simple as someone watching today calling the number they're going to see and just say, I'd like to go to the second opinion clinic, and you can schedule them an appointment.
That's as simple.
Pretty much that simple.
It's that simple.
Okay, and about how long do you factor in for the appointments? Do you know?
Typically we try to see them within the week. Okay. And if they've received a breast cancer diagnosis, then we try to get them in within 2 days.
Okay, and they're there for a little bit of time, half
Right,
an hour to an hour?
I would plan to be there for at least an hour, maybe two, just depending on the patient.
And because you want to have enough time to talk.
Absolutely.
It's not a hurried through process.
It is not rushed.
It's one more reason why the MaryEllen Locher Breast Center continues to be up here as a standard bearer for the quality of care giving patients, and to think it's right here in Chattanooga. You don't have to travel to get the help that you need. So consider giving them a call. The MaryEllen Locher Breast Center at Memorial, MaryEllenLocher.com is the website, 495-6744, the phone number. Get that second opinion, and again, you said, Angela, they can self-refer.
Absolutely.
Thank you so much.
Thank you so much.
We're back after this.